I'm so excited about this panel about bridging gaps in women's health, which particularly in this environment, much of the traditional support from the federal government to close some of these gaps is being dismantled. And so there are huge, huge gaps in this space, everywhere from R&D to treatment to how we communicate about these incredibly important issues. Kaylon, I want to start with you. Historically, there have been gaps in research, funding, and development, and for diagnosis and treatment across women's health. As the private sector is given a larger role in funding R&D, given everything that's going on, how is Merck working to close these gaps?
You started with the easiest question.
Yeah.
Well, I thank you, Charlotte, for that. And because I'm in DC, I'll change the question a little bit, which is to say that Merck is really interested in advancing health through a number of ways. We think about women's health holistically. So everywhere from R&D, as we said, we have a women's cancer portfolio. But to the work that I get to do in social impact and sustainability, one of the examples I would give is MammoTest. So part of my portfolio is investing in impact ventures. MammoTest is a digitally focused AI company. They are focused on diagnosing breast cancer. Just in the very short time that this company has been around, they have now diagnosed 750,000 women with breast cancer. Yes. They've also touched over 4,000 healthcare workers. So that's just one example of the kinds of innovation that we're able to invest in. But I would be remiss to say that, we go externally a lot with these conversations, and I think it's important when you think about companies like ours or any to be thinking about what we do for employees. And so one of the things also that we do when we think about women's health is a screening time off, for example, which allows our employees to get preventive health screenings. This is something that we support globally, and it's really our way of thinking holistically about overcoming some of the barriers that women face in getting timely access to care.
Wow.
Yeah.
I want to, again, because we're in this very particular moment where a lot of funding sources are being disrupted, particularly around closing some of these gaps. I mean, you see some of the messaging coming from this administration talking about pulling back on anything having to do with diversity, equity, and inclusion, anything having to do with specifically women's health in some cases when it comes to funding. Is the approach to communicating Merck's work around its R&D changing? I mean, what, if anything, is the company doing differently in this environment?
I say that we've always kept our eye on the prize for science. When we focus on science, we cannot go wrong. And so we have a lot of programs in our research portfolio that are still focusing on the most vulnerable communities. One of the programs I would argue is one of the best that I've seen is a Go Further program, which is an independent study that we have funded to look at HIV and HPV in women in Africa. This is incredibly important because it turns out, if you know, HPV causes cervical cancer. And so a woman who has HIV, who therefore is vulnerable, has immunology issues, may get cervical cancer even faster and more significantly. So the research that we're really thinking about is an intersection of women's health, not just condition by condition in silos, but really thinking holistically about her experience. That's just on our research portfolio, as I mentioned. In our social impact space, it's even more important to us to be thinking holistically, beyond the pill, providing opportunities to strengthen health systems and provide access to care that women otherwise would not get. So frankly, I see this as an opportunity, as this happens to be a time of opportunity for us to lean into the partners that we've always had, but to also be a partner to those folks who may have had their resources pulled. This is why we continue to do that work. Yeah.
Dr. Huang, we're also seeing issues of access to coverage for women rolled back because of the Medicaid cuts and the rollbacks of the Affordable Health Care Act, the Affordable Care Act. As a provider, how are you feeling in this moment? How can you help your patients access care when so much of the government funding is being stripped away?
Yeah, well, first of all, thank you so much for inviting me to be on this panel. And I think one of the really exciting things about this panel is that you have representation from so many different sectors of healthcare. We are really being hit particularly hard, and I think those patients who can least afford to have health care are the ones who are having their health care taken away. And I think it's a moral imperative that all of us are aware of this and do what we can to support them. I think what we've had to do at our institution, and I think lots of other hospitals as well, is rely on philanthropy and rely on community resources that are outside of the usual insurance carriers. And I think this is really a time for insurance carriers to step up too as federal funding is diminished, but really to understand that this is kind of a moral crisis that we're going through. And we at our institution are actually making a bigger effort to try to do pro bono activities for patients and really plug into our community resources that are able to fund patient care outside of the usual federal funding.
Dr. Ashton, I want to go to you. There is so much questionable health information out there right now, particularly around women's health. I just read a story the other day about sort of people stopping taking their hormonal birth control because of TikTok trends that they're seeing. At the same time, on the federal level, Secretary Kennedy is pushing unproven science around vaccines and wellness. How can medical professionals combat this? Do doctors have to be influencers now?
Well, first of all, and I echo Shelley's thanks to Time, and it's such an honor and a pleasure to be in this room and on this panel with such incredible women. I think in some ways, doctors and health professionals have always been influencers, right? Except that wasn't a four-letter word until recently. I think, hopefully we've always had an influence on the lay public in terms of helping to guide their health and wellness, and also helping them navigate the healthcare system when they're not well. Now, if I had $1 for how many times on Good Morning America I said, Dr. Google did not go to medical school. So, and they're not going to operate on you in the middle of the night. They're not going to answer the phone if you call in the middle of the night. However, I think that the precarious times with the mistrust and distrust about science and medicine has to be tempered with what, again, is an opportunity. I think we're all glasses half full type of people. And I think the opportunity is that because a lot of people, so many people have a screen and they can do their own research, you're never going to hear me say that that's a bad thing. When it becomes a bad thing is when there's no one to interpret that research or give context or perspective to that research. And that's when one of my favorite sayings is sometimes the messenger is as important as the message. And so, yeah, I think there is a crisis in terms of how we get our medical information. I think it's more important now than ever to make sure that it's being obtained from a credible and credentialed source. And not everyone with a few million followers is credentialed, as we all know. And I think it's never a bad time to reiterate that to everyone. You have to ask the right questions. And I always will think that it's better to teach someone how to think like a doctor than teach them a fact that we may learn tomorrow has evolved or is not true, or we learn more. And so it's really how to teach people how to interpret the information that is so readily accessible, and how to say, is this from a credible source? Is this methodology sound? How many people, and when we have people like we do right now, just making statements with a huge platform that not only haven't been proven in rigorous, high quality medical science, but we know the opposite, I think that literally puts everyone's health at risk. So I think it's an important time.
And Jen, I'd like to build on what you're saying, because I think the responsibility is also on the healthcare providers, where a lot of times we were talking about this together, we don't do such a great job. We are not as great at communicating our thoughts as, a lot of these influencers. So I think the burden is actually on us to do a better job communicating our message. And when we have exciting new research findings, we need to communicate that in a way that people can understand. It needs to be something that's more accessible and that people can understand what impact it has on their own lives. So I think this is something that really needs to be taught in medical schools, as we were talking about.
Agreed.
We're not doing a good job. We definitely need to teach each other how to do that better.
And just on that point, just to build a little bit,
Communication.
on the communication point, one of the things we've been really thinking about is taking a local for local approach. I think it's really important as we think about developing new opportunities for better health care, for accessing information, that we're doing that from the community's perspective, with the community, that the community is actually able to then transmit that information to other community members who are trusted. And it's very important that we do that. One of the programs that we have with Merck for Mothers, and we have our head of Merck for Mothers here, Jackie, one of the programs we have is actually in New Jersey, just over the bridge there in Camden. And what the healthcare workers found is that a lot of women were coming in, getting pregnancy diagnoses, but having no follow-up. And so what we were able to actually do is invest in community-led solutions that would give women information so that they would get the appropriate follow-up. But that was really getting out there and doing, going into the communities and actually doing follow-up with them. And those are the kinds of things that I think will be really important as we round out information for various communities, especially, and that's where I hammer in, the most vulnerable.
So I'm actually really glad that you brought this up, because this is literally my next question, particularly about maternal health care. Can you tell me more about what you've learned from patients about how to rethink maternal health care in a way that isn't so divided between prenatal, postpartum, infant care? It seems like Merck is pioneering some pretty interesting holistic approaches.
They have.
Yeah.
And it's interesting because I inherited a lot of this. I'm very new to Merck, and I love the team, and I love my job, you can tell. But I inherited Merck for Mothers, which is a $650 million program that started in 2011. We've touched more than 35 million women with the work that they've done. They've trained over almost 1,000 healthcare providers. But what I think is interesting is that maternal health should not be done in a silo. Going all over the world now and really seeing all of our sites, what we note is that maternal health is the entry point to really understanding how to strengthen an entire health system. So we really see it as an opportunity to think holistically about how to care for women, and it's often through the maternal health lens or even through maternal health care that we're able to do that. We think about cardiovascular care, for example. Cardiovascular care happens to be the leading driver of maternal morbidity and mortality in the United States. So we work with the American Heart Association, and we've developed programs that will now set cardiovascular screenings in maternal health protocols. These are the kinds of things that we're able to do when we think more holistically about maternal health, not just giving birth and not just post-birth, but through the life cycle of a woman. And I think, especially at Merck, given that we're able to serve women across the continuum, whether it's in prevention of HPV and therefore cervical cancer, or whether it's in our maternal health portfolio and program and helping communities strengthen systems, or whether it happens to be in the treatment of cancers, of women's cancers, which of course we have a portfolio for. I think all the way across, we're really seeing it in a holistic manner. And I don't think of it as women's health. I think of it as the health of women. I think of it as not just talking about women as reproductive bodies, but understanding that maternal health care is a fourth vital sign for our society. And it's incredibly important that we understand that if we are not taking care of mothers, if we're not taking care of women, we're not taking care of our families and our communities. And that's where we start and that's where we end. And so I'm really proud, actually, of the work that we've done.
So can you just explain a little bit, what do you mean by fourth vital sign?
So there are many vital signs in communities and understanding what is healthcare. Whether it's cost, whether it's affordability, whether it's access to the system, right, transportation and the like. But really understanding the strength of a maternal health system and women's health in any society, in my mind, is really speaking to then what that society cares about. And so we really see it at Merck as a fourth vital sign. I'll tell you, it's interesting because I was told when they started Merck for Mothers in 2011 as a global program, no private sector companies were really entering this space at all. It was a really big conundrum. We knew maternal health and maternal morbidity was a problem, but the question was, how do you do something about it? And Merck really stood up and said, we're going to develop a public-private partnership. We're going to work with people across sectors, not just in the pharmaceutical industry, not just in healthcare, but across different sectors to come up with plans and ideas on how to change the trajectory for women. And so it's been a really incredible opportunity for us, I think, to be thinking much more holistically than just in, again, pregnancy.
Yeah.
Yeah.
Dr. Wong, I want to go back to you because we were talking a little bit earlier about communication. And I'm curious how you handle it when a patient comes in and they have some ideas of a diagnosis or a treatment plan that they got from ChatGPT or TikTok. How do you approach that conversation when you're coming in with all of your medical training and you're having to convince a patient that their ideas that they got from the internet are wrong? Or maybe they're not wrong.
I think what my training has taught me and what my experience in medical care has taught me is just an intense humility for what I don't know. So when I go into a room with a patient and they tell me what they think they've learned from the internet, there are times when I learn too, because they've done an extensive research into this, mostly because they're living it, they're going through it. It could not possibly be more intense for them. And a lot of times they have studies that I didn't know about or questions that I haven't thought to ask before. So I think that's really the approach that many of us have, is that we have a lot to learn too, but we also have the experience of what comes from what we learned in medical school, what we've learned from on-the-job training, what we learned from conferences and the best guidelines that are out there. So I think the best provider is able to combine both of those things. I mean, I don't think that I would ever recommend that patients go to Dr. Google instead of coming to a licensed physician, but I think we have to have a fair amount of humility about what we don't know and what patients are interested in hearing about. I think that's really the best way to meet patients halfway. And you didn't ask this question specifically, but to follow up on what was said before about pregnancy, there are incredible strides being made for women with cancer who are able to get pregnant after their cancer treatment. So I think that's an incredibly positive message that I think everyone should know. There are incredible strides that are being made to maintain fertility and the ability to get pregnant after cancer treatment. And I also, it's really exciting, but I also want to say on the flip side, when women are getting diagnosed potentially with very life-threatening malignancies, I think it's really important to also keep in mind that women should have a choice about whether to have pregnancies or not. And I can think of many instances where I've had patients who found out they were pregnant and had breast cancer in the same week. And so if you don't think you know what that stress feels like, it is painful, it's intense, and we need to be able to take care of those women and allow them to make the choices that are right for them.
So I'm really glad that you brought that up, Dr. Wong. Especially you practice in the South. What have you seen over the course of the last few years since millions of American women lost the right to an abortion? How has that changed the landscape of women's health?
Well, clearly it's changed choice for women, but I think the other really important part of what I've seen is that there are physicians who don't want to practice in parts of the country where they can't do their best work. So I think women are doubly affected because not only do they not get the access to care that they need, but they also don't get the providers who could potentially provide that access. And I think we've all heard stories about women traveling, driving hundreds of miles to get the care that they need and then finding that it's too late. I think that's another one of these crises that we've experienced recently that we actually have within our power to do something about and to change what our country is doing and how we feel about this. So I think, in my practice, women don't have a lot of the choices that they should be having. I still think that they need to have the care, and they should not have to be driving hundreds of miles to get it.
And I think also what did not make it into this media coverage is that OBGYNs are the primary care doctor for women.
Yeah.
They're, again, that was not in the headlines. So, when women have chest pain, they call their gynecologist. They don't go leapfrogging right to the cardiologist. When they have a skin problem, they call their gynecologist. So right now, I've heard numbers as high as 50% reduction in the OBGYN residencies in red states where medical students are not even applying to those programs. And then when they finish training, there are obviously a lot of doctors who will not stay in a state where they could be put in jail. So it has to be realized that this is a ripple effect that goes way beyond just reproductive health, as if that weren't bad enough. I mean, these are the only medical professionals that the majority of women see over the course of their lifetime, who screen for depression and heart disease and various types of cancers and write the mammogram prescription slips. And those doctors are not going to be in those states. And then, to complete the circle and connect all the dots, if they travel into other states where there are clinics and Planned Parenthoods, and I'm sure this is a very well-informed audience, only about 2% of the clinical services that Planned Parenthood performs has to do with pregnancy and abortion. Planned Parenthood sees men. Planned Parenthood provides care for diabetes. So if everyone is flooding into the blue state Planned Parenthoods because they can't get that care in red states, it is going to affect everyone for every type of thing, not just pregnancy.
So, Dr. Ashton, I'm so glad you brought that up. That's such an important point. I want to ask you also about sort of the other side of the reproductive lifespan, which is menopause.
Having a moment.
Having a big moment.
Yes.
What do you wish more people understood about menopause, and how do you see society sort of changing their conception of menopause?
Well, the first thing that I think is not getting anywhere near enough attention is the first three letters of the word, which is men. Men, I think, have been petrified into being silent in this discussion. They cannot be. They are not only necessary and needed, but they are welcome and they deserve to be involved in this conversation. So if you have a Y chromosome and you are sitting in the room, please, we need your help, number one. Number two, I think that it's great that everyone with ovaries, regardless of how old they are now talking about their first hot flash, and everyone's giving it attention. It's way overdue. But I think that the narrative is critically important. And I think it can't be a narrative of blame or shame or no one told me, woe is me, women are always the victim. That does not help. We are behind in terms of our funding and research and attention for all women's health issues. It really is, in my medical opinion, a national embarrassment. But looking back in the rearview mirror is not going to help. We have way too many things we have to address. And so I think when you talk about menopause, it's literally the back nine. It could be the beginning of the second half of a woman's life. Easily now, women can live to 100. So, I think that part of the reason it's getting so much attention now is that the world, truly globally, and the $26 billion menopause economy that is being fed now has woken up to the fact that oh my gosh, women in their 50s are in the C-suite. They are, running governments. They're at the top of their entertainment career. Ooh, maybe we should pay attention to this now. Okay, yes, should have happened a long time ago, but it finally is happening. And everyone needs to be involved in that. And to quote two men in my family, my son and my husband, my son, who's 28, said to me, "Mom, do you have menopause?" And I said, "It's not a disease, Alex. It's not a disease. So let's start there, okay?"
Although sometimes,
And then, okay, and he's kind of smart. And then my husband said to me, "Do all women go through menopause?" Again, like hushed tone. And I said, "Only the ones that are alive, honey." So I mean, I think when you start there, we need to keep talking about it, but the message has to be done in the right way. It has to be productive. It has to be forward-facing, and we need everyone to be involved in this conversation. Just hopefully not with the same comments that the two men in my family led with.
in the South they say, bless his heart. Yes. But I will also note, and to that point, that it really does require all of us. It requires men and women to be part of women's health. In order for women to get better, in order for them to have healthier access to care and healthier outcomes, we need men to be involved. And same with boys and girls. In order to get over HPV and in order to get over some of these conditions that we're facing, we need both boys and girls to be vaccinated, for example. So these are things that we are focused on, not just at Merck, but across the board, and I hope that everybody in this room will certainly be as well. So thank you.
So before we go, we were just talking backstage about some very exciting news that I'm hoping some of our panelists can share. There have been some pretty exciting breakthroughs in the breast cancer space. Dr. Wang?
Yeah, I would actually say in healthcare more broadly, for the first time, there's attention being paid to the fact that the immune system is an incredible source of power that we have to treat so many different kinds of diseases. You name it, and the immune system is involved in some way. And I think just this growing recognition has been kind of transforming healthcare. And I'm really excited to know what this means for not only cancer, but heart disease. I mean, there have been many drug companies that have really been on the forefront, and they have been driving changes in cancer where we had incurable cancers that are being cured now. I mean, people are living for a very long time with cancers that we thought were death sentences before. So just incredibly exciting, transformative treatments. And I think the one thing that I really wanted to put in a plug for is not only are there treatments that are immune-based, but there are new preventive strategies, just like the cervical cancer vaccine. We, in our group, are working on a breast cancer vaccine. And when you think of 1 in 8 women being diagnosed with breast cancer at some point in their lifetime, I am really excited about the impact that a breast cancer vaccine will help. And it's something that we have within ourselves to fight cancer, and being able to use that power to prevent cancer, not only in breast, but in lots of other different sites as well. And this is something that's very relevant to you men in the audience, too. It's a really exciting time to be in medicine and in science.
Great. Well, thank you so much for joining us. This has been such a fascinating and inspiring conversation. Thank you.